Hi everyone! So today we're going to discuss malaria. It remains an important cause of death in adults and children. Malaria is a disease endemic to Africa, Central and South America, and some parts of the Middle East, and later on spread to our country, the Philippines. It is the most parasitic disease of humans and causes hundreds of millions of illnesses per year. It is usually transmitted to humans by a feeding female Anopheles mosquito. This mosquito transmits protozoan parasites of the genus Plasmodium and causes infection of the red blood cells. Symptoms of malaria don't usually appear until 2 weeks later after the initial bite. The first symptoms of malaria are nonspecific and similar to those of a minor systemic viral illness. Malaria is usually clinically suspected primarily on the basis of fever or a history of a fever. Other symptoms of malaria include headache, fatigue, abdominal discomfort, muscle and joint aches, and usually followed by fever, chills, perspiration, anorexia, vomiting, and worsening body malaise. Monotherapy for the treatment of uncomplicated malaria is strongly discouraged. Rather, co-formulated artemisinin-based combination therapies are recommended to improve efficacy and prevent the selection of artemisinin-resistant parasites. The most common treatment for uncomplicated malaria in the Philippines is an oral combination regimen of artemether-lumefantrine or co-artem, and it is taken 4 tablets orally twice a day every after breakfast at 10 a.m. and dinner at 6 p.m. for a total of 3 days. So how does malaria affect our body? Let us first briefly discuss how the parasite inside the mosquito can affect us. Also, this is important to know because the treatment targets a specific stage of the parasite's life cycle. The parasites responsible for malaria are known as the Plasmodium species. The Plasmodium parasite is carried by a female Anopheles mosquito. When the mosquito bites, it releases sporozoites into the bloodstream and invades the liver cells. In the liver, these sporozoites mature into schizons and eventually rupture in the liver cells, releasing merozoites that enter the blood circulation. The released parasites will now invade red blood cells in which clinical manifestations will appear. Our drug of choice is artemether, which rapidly clears parasites from the blood. Artemisinin combination therapy is a combination of a rapidly acting artemisinin derivative with a longer acting or more slowly eliminated partner drug. The partner drug lumefantrine clears the remaining parasites and provides protection against resistance to the artemisinin derivative. The parasites within RBCs use hemoglobin as a food source, specifically the globin component. The heme component is converted to hematin and detoxified.